1 in 13 people in the U.S. has asthma. The chronic condition makes it harder for people to breathe. And here in the South, where textiles run deep, the humidity is so thick, people have an even higher risk of having an asthma attack. In this 2-year well-being report, WFMY News 2's Tracy McCain talked with a Cone Health doctor about the risk factors and the new treatments to manage asthma.
Peggy Clow is breathing easy now, but not too long ago, the Guilford County mom struggled for air.
Not being able to catch my breath, and you get to a point where you're coughing so bad you're gagging.
Peggy often felt winded and felt a painful tightness in her chest.
Take some nice big deep breaths for me.
Shortness of breath turned into wheezing and an emergency.
Wheezing is sort of an exhaled musical sound.
You'll hear that loud, labored breathing during an asthma attack. As airways tighten, it's harder to get air in and out. And in Peggy's case, that was happening almost every 30 days.
Peggy was getting treatment for her asthma with exacerbations with prednisone and antibiotics almost every month, and it was really interfering with her quality of life. And so we sat down and kind of really re-examined what her triggers would be and adjusted her inhaler therapy to try and get that under better control.
Dr. Nikita Desai specializes in lung conditions at LeBauer Pulmonary Care.
Have you had to use your rescue inhaler at all?
Asthma runs in families and can be related to smoking or secondhand smoke, air pollution, and industrial chemicals, too. She says all sorts of environmental factors trigger asthma, including where you live.
Greensboro is actually a city that consistently ranks amongst the worst for asthma control across the country.
And that's based on?
Based on looking at the number of times a patient has to come to the emergency department or needs rescue medications like prednisone for their treatment.
Allergies can set off symptoms too.
Here in North Carolina, we are lucky to have beautiful trees and beautiful flowers. We also have heat and humidity in the summer, and all of these things can contribute to poor asthma control. We also look at things like air quality and socioeconomic status, which play heavily in asthma control.
Infections from viruses or bacteria can also cause asthma to flare up.
Whether that's allergies or infection or other medical conditions. And generally what happens is that trigger goes into your lungs and causes a narrowing of your airways.
Opening them up requires medical treatment, mostly through rescue inhalers. Severe cases require steroids, antibiotics, albuterol, and often a trip to urgent care.
I was on steroids all the time, I was on antibiotics all the time, and my body could not fight it back. And I just really think that eventually it would have just gone to being on an oxygen tank all the time.
Dr. Desai says there are new ways to keep it from getting to that point.
In the last 5 years, we've had a lot of breakthroughs in asthma treatment. These are new medications that were never available to a lot of our patients who have had asthma as children, so a lot of them may not know that these treatments are out there and available.
Maintenance inhalers like Flovent keep lungs calm when exposed to environmental triggers. The medication Dupixent also improves breathing and prevents severe asthma attacks.
An inhaler in the morning. I take an Allegra tablet for allergies, and then I take the Dupixent shot every 2 weeks. And that is what really helped me go over the bridge.
All right, so you just heard one patient's story about how they have a happy, healthier life despite their asthma. We want to answer your common questions about warning signs and symptoms with Dr. Nikita Desai from LeBauer Pulmonary Care with Cone Health. So she's going to answer common questions, let you know when it's time to see a doctor. So let's start with just the very common thing, like the risk factors. What are some things that could make it more likely for someone to develop asthma?
Sure. Well, first of all, thank you so much for having me. Historically, Greensboro has ranked amongst the highest for patients with poorly controlled asthma in the country. So this is just such an important issue for people in the triad. And I'll start by saying that it's a pretty common misconception that asthma is just a disease for children. It certainly can occur in childhood and for some people can persist into adulthood. But sometimes it can be just a brand new disease for adults. So don't think that just because you're not someone who had childhood asthma that you're in the clear. Certainly family history and a history of childhood disease is something we consider. So if you've got someone in your family who has asthma or allergic diseases, that's something to consider. Smoking is another big one. You may have a personal history of smoking, which could factor in, but what we call passive smoke exposure or secondhand smoke exposure is also a risk factor. One of the biggest misconceptions for passive smoke exposure is actually that, if someone's living in your house, they'll tell me, oh, well, they smoke in the other room or they smoke outside. That's still very much considered passive smoke exposure.
Because the smoke then gets into all the fibers of the couch and clothing and things of that nature.
Exactly, exactly. And then we also consider, as I mentioned before, allergic disorders. So diseases like seasonal allergies, asthma, those things really run together with eczema as well. So those are things to consider. Another thing I wanted to mention would be like workplace related occupational exposures. So here in the triad, we have a history of having textile factories. We have a lot of farming communities. We also have, of course, a history of tobacco factories. And so all of those things and exposure to all those things could certainly predispose you for asthma.
Okay, so if someone has asthma, maybe what are some of the symptoms that might tip them off so that they don't get it confused with something else, like allergies or something else?
Yeah, there's certainly overlap of symptoms, so people can have coughing, and allergies can coexist with asthma, so that can be confusing. The most common symptoms for asthma to consider would be chest tightness, difficulty breathing, wheezing, coughing. And, those are the classic symptoms, but the hallmark of asthma is really that it's a chronic, episodic, and triggered disease. And so if we break that down, chronic meaning it's going on for a long time. It's not just something that's happening for a week or two. This is something that's persisting for months to years. Episodic means that there's something that's triggering your asthma, triggering these symptoms. Maybe you're always around a certain exposure or a certain place or a certain time of year. And, those are really the important factors, to know that it comes and goes is an important hallmark of asthma.
Okay, so what we're going to do, we're going to take a quick break. When we come back, the first question we're going to be is, okay, when do we need to see a doctor if we have some of these warning signs? We're going to answer that question and much more when we come back. We are back with another segment with Dr. Nikita Desai. She's talking about asthma and ways to manage the condition if you have it. All right, so we were just talking about what some of the symptoms are and things of that nature. Now I want to know, when do you go to the doctor? Because that is always the age-old question, no matter what it is. When do we go?
That's a great question. And so when I get to start getting concerned about a diagnosis of asthma, I'm looking for someone who's had chronic, recurrent, again, those episodic conditions. And so on average, we say getting bronchitis or an upper respiratory infection once a year is considered normal. Anything more than that, if you're someone who's getting bronchitis multiple times a year, or if it's typically associated with seasonal allergies or any seasonal changes, or if you feel like when you get an upper respiratory infection, you have symptoms that linger far beyond anyone else in your family, those are times when I would be concerned that there's something else at play.
Right, when that cough just doesn't go away for a month or two, that kind of thing, you probably need to go back and revisit that. All right, so what might make someone's symptoms flare up? Maybe they lay dormant for a little while and then they come back again.
Yeah, so I think you're asking sort of what are common triggers for asthma. And certainly here in North Carolina, the first one that comes to mind is because of our beautiful trees and flowers. We have a lot of allergic symptoms related to pollen, which is a very common trigger. Upper respiratory infections, especially viral infections, more so than bacterial, are common trigger for asthma. But other things like exertion or exercise, stress, dust mites, cats, dogs, smoke, all of these things can affect us. And air quality is an important factor for that too.
Okay, and I'm guessing this is going to roll right into this next question that I have, which is, of course there's medication out there, right? But what can any of us do to help kind of control those kinds of triggers?
Yeah, I think there's only so much we can limit. But, in the last couple of years, we've become really good as a society for avoiding sick people and trying to take reasonable precautions. So avoiding getting sick with an upper respiratory infection, especially those viral infections in the wintertime, is super important. If you know you've got allergies, treating those allergies and maybe even getting allergy shots, if that's indicated, would be important. And really treating all your other conditions that could make asthma worse. So if you have sleep apnea, if you have acid reflux, if you have sinus disease, those are all important things to get under control, to get your asthma under control.
Okay, and if someone has asthma, they might feel like they want to stay away from exercise because they're having difficulty breathing and that kind of thing. So do you recommend people with asthma exercise?
Yes, absolutely. So while I did mention that exertion can be a trigger for asthma, exercise is so important for your health, but especially for your pulmonary health. And so talking with your doctor, if you do have asthma, about safe ways to start exercising and keeping that a part of your routine is also something you should ask about.
Okay, and that is going to be my follow-up question, of course. Like, how do we manage our symptoms while we exercise?
That's something you would want to talk with your doctor about, but a lot of times people take inhalers for their asthma, and that's part of the treatment. And there's maintenance inhalers, which you take every day, and there's rescue inhalers, which you just take sometimes. But sometimes those rescue inhalers can be used almost preventively to help make exercise safer. But again, that's something you should talk with your doctor about.
Okay. Now, it's flu shot season, of course. We have an updated COVID booster that doctors are recommending. What should people with breathing conditions do to stay updated on their vaccines?
So definitely follow up with your primary care doctor, your pulmonologist, or whoever helps take care of you about getting those vaccines and getting them up to date. They are super important because we have really good evidence to say that preventing infection and preventing recurrent flares or exacerbations of asthma can help maintain lung health and function.
Okay, asthma attacks can be really scary. So what are the early warning signs of an asthma attack so we can kind of prepare ourselves and change course?
Yeah, so I would say, sudden onset of shortness of breath, chest pain, coughing. If it's triggered by something and if you can identify a recurrent episode, that's super helpful. So if you do go see your doctor and you have some diary or some identification of things that seem to set you off every time this happens, that will be very helpful for whoever's taking care of you to help make this diagnosis.
Okay, and if people are experiencing an asthma attack, they should do what?
Well, there are different degrees of severity for asthma attacks, but certainly if you're unsure, if you have episodes of inability to catch your breath, if you can't finish sentences, if you have a pulse oximeter and your oxygen levels are dropping, those are all signs to go to the emergency room. If your symptoms are more gradual and kind of slowly coming on, you may have some time to talk with your primary care doctor or to talk with a pulmonologist.
Okay, and it's good to make that differentiation so you know. All right, great information. We want to make sure you at home have all of this information. Maybe you need to share it with a family member. Check out our 2-Year Wellbeing section. We're going to have it all posted there shortly.